or another important statistic here in Connecticut, that's actually highly unlikely. The goal and the purpose is that there should be something in the exchange that could and should fit your needs, right? And I have another statistic in the presentation to talk a little bit about of those people who did attempt and try, right, how many are actually enrolled, right? Right. How many received subsidies, right? For how many was this a successful process to embark on?
And how many more did not?
Yes. So the did not, right,
yeah,
is also a very important number, right? So I want to talk to about, so we could talk about all the stuff that's not working, but I always like to look at things, the glass, always full, right? Because we started this conversation about why it's important for our communities to understand and to participate in this, right? We can be here for hours talking about some of the preventable diseases that afflict us as a community more than anybody else, that are preventable, and that's an active word, as well as the fact that it's the first time ever in the history of our country that access to some form of comprehensive health care is being made available, regardless of your economic status. Yeah, there's a...
I hear somebody told me, I don't know, because I never go inside the computer because I don't need it, but I hear it's too late already for people to apply.
No, but we'll get to that too, right? Because it's never too late. It's never too late. And again, misconceptions. And I started the dialogue with why I'm here is because there's a lot of stuff. And the way we get, right, we talked about information, we talked about novelas, let's throw church in there, que fulanita te dijo, it's too late, and so, okay, it's too late, so I'm not going to do it.
Correct information.
So, and really that's how our community, that's how we socialize, that's the trusted sources of information. And so in as many of those trusted sources that I can plug myself and my team in to be able to continuously bring updated information is the goal of why I'm here and why I'm working with the Bridgeport organizations. So for Connecticut specifically, how we're benefiting, this is the second enrollment cycle, right? So this is the second time that this has happened in the state of Connecticut. And that ended on February 15th, correct. Since then, more than 250,000 Connecticut residents have successfully obtained affordable health coverage through Access Health CT. And what that means is that they have access to and have started using already health benefits like your annual doctor's visits, prescriptions, preventive care, which is very important in our community, right? So it's not I'm sick, I'm going to the doctor. No, I am being proactive in preventive health care to prevent diabetes, to prevent heart disease, to stay healthy, right? Every Connecticut resident right now can no longer be denied coverage for a pre-existing condition. Before the Affordable Care Act law, if you had a pre-existing condition, specifically, and we can talk about cancer, breast cancer, or we can talk about any chronic pre-existing condition, the insurance company could say, you've been capped and you've tapped us out, we're cutting you off. And when you think about chemotherapy or you think about some of the other high cost long-term treatments for some of the diseases that afflict us, that was putting people, they were losing their homes, they were stopping care, which is should never be an option, right, if you're sick. So there were very, very negative effects prior to the Affordable Care Act and this piece of legislation passing. Connecticut residents, so Connecticut residents with some of the pre-existing conditions like asthma, cancer, diabetes, no longer worry or have to worry about being denied coverage. Or the other option was that if the insurance company didn't cut you off, they could always hike up your rates, making it unaffordable to keep the insurance you had to continue your treatment. Okay? More Connecticut residents now than ever before have access to mental health and substance abuse services. That wasn't necessarily part of the insurance pool for many people. So maybe, the insurance you had through an employer let you go get a physical every year. Dental? Possibly not. you know, and so there were these other kinds of services. And so what the Affordable Care Act, and the goal and the aim is really to take a look at the individual and health, and do so with a comprehensive lens, right? So great, you have access to a doctor before the law, but well, dental disease is linked to heart disease. And if you have or you suffer from dental disease, what's the point of treating your heart when your mouth is part of the problem? And if you didn't have access to that, or the means out of pocket for that, right? And then young adults in Connecticut now can stay on their families, on their parents' health insurance until they're 26, which is a great way when we're talking about educating our young, right, about prevention and health, to do so, right, by not kicking them off. More Connecticut children now have access to dental health benefits, including cleanings, checkups, and fillings. Very important. And then, you know, like I said, we can get into socioeconomics, right? And when you talk about poor children and who makes up poor children in Connecticut, again, African American and Latinos hold that top rank also. As a state, you know, we're looking at healthcare and health equities. Another dense slide, and I'll get through this one really quickly. What does that mean for you, right? So you're sitting in this room, I'm sharing this information. Basically what that means is that through our exchange, you are supposed to be able to find a low-cost plan that meets your needs. Remember that there's financial help available and that you should know what that help is and what it looks like. So for example, to answer your question previously, an individual in Connecticut earning $45,960, or a family of 4 earning combined $94,200 a year, for example, still qualifies for a subsidy.
Can I clarify
Yeah.
that particular?
Please.
Okay. I have a daughter who has aggressive cancer,
Mhm.
unfortunately.
Mhm.
And she's got diabetes and she's got high blood pressure.
Mhm.
Okay? She applied for that.
Mhm.
She makes $42,000.
Mhm.
Okay? She had to pay $215 out of her pocket.
Mhm.
That's gross.
Mhm.
That's not what you bring home.
Mhm.
She says, Mom, I either pay my rent or I pay this insurance. She can't afford it.
Mhm.
So now she's facing penalties,
Mhm.
which is
And we're
everybody
gonna get
faces.
to penalties
So that's
next,
where
yeah.
she's at. So this is
Yeah.
what I'm saying.
Is she
It
appealing
looks
the
nice
penalty?
to
No,
me.
is she appealing the penalty?
No.
So laying down the
No,
foundation
she's just
so that we can.
She's just had it. When you have cancer,
Mhm.
aggressive cancer, and you have
Mhm.
diabetes, and you have all
Mhm.
this, you know what? And there's a, there's a
And is she
million-
currently unemployed?
No, she's
now?
working, but she can't afford to.
The $215
Yeah, I
copay.
mean, you either pay your rent or you
So,
don't.
correct, so then, basically, so through some more numbers, right, so that's supposed to mean that out of the people who have accessed the exchange, that 9 out of 10 of those families or individuals, that signed up, receive financial help.
She wasn't offered anything. She
Okay.
says you either pay the $215 or you face a penalty. That's
And
what
where
she
did she
told.
go to enroll?
In Hartford. She lives in Hartford.
Was it through a navigator, was it through the actual?
The actual.
Okay. So,
access.
and the goal, and it's supposed to be, right, and I keep using these words, right, that
Supposed to be.
that when you don't, that, right, that what you're trying to prevent is not having health insurance, so you're not gambling, you know, when you're sick, when you're injured.
I just had to pay $8,000
Right?
for her teeth, because she's losing her teeth.
Yeah, because of the
So it
treatment.
cost me
So then this is where I come in, right, and then this is where, part of, the education I do in our communities. So when you think about Access Health CT or any exchange, right, what they are like supermarkets. And as consumers, right, when you go shopping at the supermarket, some of us clip coupons, some of us make sure we look at the sale flyer for that week to make sure, you know, whatever's on sale we know about that we can go and, right, because that's really what it is. It's the cyber supermarket around something so very complicated and emotional, because you're talking about health and you're talking about sometimes being sick when you're accessing it. And it's not easy, right? Actually, my husband told me last night, I was going through the presentation, he's like, you know, what it should be more, it should be like Flow and Progressive, right? That even if you're not going to buy Progressive, that Progressive gives you who the best package is for you. That it should be more like that. And I was like, you know what, that's That's actually a great analogy. So this exchange in Connecticut is supposed to be able to facilitate that process for you, so that you're able to compare costs and benefits and plans aside. The problem with that is, how does it work, right? And it doesn't work the same for everybody. There are 4 standard plans, and this is national. There's a platinum plan, which is the highest premium offered on the insurance exchange, which means it's the highest out-of-pocket payment that a person would look at. But what it's supposed to do, it's supposed to offer coverage of at least 90% of your medical expenses. I will tell you right now, this law will not. There is not a plan that covers anything at 100%. Not here, not anywhere else in the United States. It just doesn't exist, right? So the platinum, which is, and if you don't mind, and I'll give you my card and ask her what kind of a plan she purchased, right?
She didn't purchase it. She's facing.
She's
facing.
Okay, so I will link her up with someone in Hartford and see how we can, right? So none of these plans, there is no plan where, because you pay a premium, that you're going to go to the doctor and that you're not going to look at a bill, right? So even at the highest level, you're looking at paying the difference, right? It'll only cover 90%. The gold plan, right, is the second most expensive plan on the exchange, and that will only cover 80% of your medical costs. The silver plan will cover 70% of your medical expenses in order to qualify for a tax credit under this plan, or to qualify for the tax credit in the state when you do your taxes. You must choose either silver, gold, or platinum. So that's another thing with information, right? You know how in community you hear that, you know, there's a tax credit when you file your taxes for having enrolled on time, for doing what you were supposed to do, right? That there's this tax credit. Well, you don't qualify for it unless this is one of the plans that you hold.
A question, please?
Yes.
On each of those plans, okay, do you have to spend out of your pocket, say $3,000, $4,000 before this plan starts to cover you? Or does it cover immediately?
No, so for example, depending on when a person enrolls. So during this last enrollment cycle, if you enrolled in November, you had insurance coverage effective January 2015. If you missed that, and you enrolled after that?
No, my question is, let's say I have platinum plan, or gold, or the silver.
And it becomes effective today, right?
Right, okay. So I have to pay out of my pocket $4,000 or $3,000 before they start covering the 90% of the 80%?
No, you pay the difference. So,
Okay.
you know, here, you know, so they will only cover you 90, you cover that other 10%.
So immediately?
Immediately.
Okay.
Like I said, and I will repeat it, there is no insurance package anywhere that will cover anybody at 100%.
No, that's...
You will always have to cover something out of pocket. The difference is that there's a difference. Obviously, the platinum premium is not the same as what you're going to pay monthly. So in addition to your monthly premium, you're also looking, if you're in platinum, to pay 10% of whatever the total bills are, right? And then,
do they monitor what the doctor can charge you, or is it up, is
yes,
it discretion?
yes, and that's why the law was passed, right? And so
Okay.
these are some of the things that the law aims to protect, right?
Okay.
You know, you can't cut somebody off because they're sick, right? You can't just say, we're no longer going to cover your treatment, right? You can't, you know, just jack up your rates from one day to the other, right? So that's what the law, and that's why the law was passed. Then there's the bronze plan, and this is the plan that most people who do interface with the exchange go for. A, because it's affordable. It's the cheapest of all of the plans that you can purchase. B, it is not eligible for a tax credit. So even if you went and you purchased a plan, you are not eligible for a tax credit on the bronze. It's the lowest cost plan available. This means, though, that only 60% of your medical costs are paid for by the insurance company, leaving the other 40% in addition to your monthly premium on you. Now, here's the thing. And this is where I compare this to a supermarket or, you know, when you're gonna go buy a car, a used car, right? We try to protect ourselves and we try to make sure that, you know, we're not gonna get duped, that we're not gonna get a lemon, that we're not gonna, and we do some research. You know, we're really trying to get folks to understand this so that when they're making decisions on their health, they're not just making it on the cost, because if you have asthma, if you have diabetes, if you are someone who on average cold flu season sends you and you're hospitalized at least once a year, you may say this is the premium that I can afford every month, but this insurance plan will send you spinning, okay? I don't know how many of us have insurance, right? So I am covered. But when you get that, this is not a bill thing, but it very much looks like a bill. Like my heart, like I get palpitations because I think about if I had to pay for this, how, right? I have a son with a lifelong allergy who requires EpiPens, right? And he's a child and he requires an EpiPen at school. He requires an EpiPen after school where he goes, and he requires one at home. And I need one for my mother's house and I need one for my mother-in-law's house because if somebody doesn't give my kid his EpiPen, my kid could die.
That's expensive.
An EpiPen, one is over $1,000. Okay? So I need at least 5, and every 6 months you need to renew them because they expire. So they only give them to you for 6 months at a time. That's a big, that's you know, so that is, if I needed to purchase a plan knowing my prescription, and this is where as a consumer, you need to sacar el lápiz y el papel, right? And we need to sit and we need to have conversations at home with spouses, with children, with, right, who lives in our household about how often are we getting sick, how, on average, what has it cost us, right? And looking at some of these statements through insurance companies or not, how often have we visited an ER to be able to make an educated financial decision that won't hurt you? Because once you enroll, you gotta wait a year to be able to change your plan. And what happens is that people kind of sit, and even when they've encountered the exchange with a person there to help them, this is very dry, dense, right? You might have not had the opportunity to take out your little pencil line and start calculating how much the medicine cost me last year. How many times did I visit the emergency room? Or, you know, ladies, this is all with the exception of the gentlemen. Mammograms, let's talk about mammograms. Right? And some of these very expensive. If you needed x-rays, if you needed, if you broke a leg, if somebody in your house broke a finger. These are the things you need to sit, like how we say, con tranquilidad, and be really real about and start calculating. It is a financial decision that you're making. In addition to it being the decision on your health and what your health and what access to health will look like that year for you, this is also an investment in a financial decision. There is no plan on the exchange that will cover you 100%. The law hasn't made our health inequities or hasn't fixed that for us. What it aims to do is to at least get the needle and the ball rolling in states, and like I said, and also state to state. It looks very different. We are one of those states where we are not on the federal exchange. We created our own. You've got other states who didn't even take that step forward. And the people have to navigate a federal health exchange. So a federal supermarket, like a BJ's or a Costco, compared to your C-Town. You know what I mean? And again, and by no means am I minimizing the importance by using these analogies. I kind of want to make this kind of, you know, real and tangible for everybody. This is less about the law and what the law is supposed to do for you, and this is more about how you educate yourself as a consumer and where, right? And so
women make the decisions in the household for healthcare.
For healthcare, for our husbands, for our children, for our parents, right? Because we're part of extended families even in this country as we live. Okay? So this is, I mean, and for me, like, any questions, because this is something that people think, oh, but I bought an insurance package and they send me a bill, but I pay every month for my insurance. Why are they sending me a bill? Because it doesn't cover you at 100%. The other thing is that read between the lines and read the fine print. Bronze may not cover your medication brand. EpiPens, there are no generic, I use my personal example, there is no generic EpiPen I don't have a choice, my son doesn't have a choice, we will have to spend $1,000 times 5 every 6 months because there's no $5 Walmart generic version for me to go get. Therefore, not only is it a budgeting financial decision to make sure that every 6 months I have that money for my medication, but that my insurance, right, whatever copay or whatever it is, my prescription plan, not every plan includes prescriptions. Not every plan includes access to dental. Not every plan includes access to vision, and I wear glasses. Right? I can't drive without my glasses, can't see without my glasses. Every plan is different. No plan is 100% covered. This is where you and the community, and again, in talking very real, step up your game and become an educated consumer, right? Because then you're locked in for a year. Okay? Medicaid under the ACA, right? So yes, the enrollment period ended February 15th. If you're eligible for Medicaid in this state, you can enroll all year round. Adults and children eligible for Medicaid, okay? So just very quickly, Medicaid is a government health insurance program for low-income individuals. Children, their parents, pregnant women, adults up to 64 years of age, and the disabled. What the Affordable Care Act law did for Medicaid was it expanded Medicaid. So that meant that beginning in 2014, during their first enrollment cycle, new health care law would add about 20 million more people eligible for Medicaid. So I can't even tell you. I was born in 1972. The last time that they've tweaked the federal formula for how someone is eligible for federally means tested benefits, right? But what the Affordable Care Act law did do, and specifically for Medicaid, was open it up for a bunch of people that just by a minimum, wouldn't qualify for state Medicaid, and that includes working people who don't get health insurance, right? So this isn't, that includes students who may not have access to a student health center or a community-based health center, right? Or if you can't be on your parents' insurance because your parents also don't have insurance. So what it did was it opened the access pool for an additional 20 million people to qualify for Medicaid. Okay? And that's including people who had never had health insurance before, because before, if you didn't qualify for it and you couldn't afford to buy it, then you just stayed uninsured. Okay? Medicaid. Do you guys know, and I always throw this out because I'm always amazed how many people don't know. Do you know that in our country, right, if you don't sign up for Medicare when you turn 65, there's a penalty, but not a penalty that you pay and then it goes away. It is a penalty you pay for a lifetime, forever. So if you have a family member who is right at that cusp, turning 65, please let them know. This is a very taxing penalty, right? It's not like, oh, I'll pay it because I didn't know. No, you need to pay it every year as long as you live. Which
unless your spouse covers you in your medical, then you don't have to pay that penalty. Okay.
Yes.
So
yes. And when you think about who receives Medicare, right? Our senior population or retired population, typically in our communities living on a fixed income anyway, that a fine for a lifetime is just, So Medicare, what did the ACA law do for Medicare? So for people age 65 or older with certain disabilities, just like for on the other end, right, for people with cancer or diabetes or chronic diseases. So for people age 65 or older with certain disabilities and people who suffer from end-stage renal disease specifically, they're covered under the ACA, their treatment, right? Medicare helps with the cost of health care, but does not cover, again, all medical expenses or the cost of most long-term care. And as Latinos, we never talk about long-term care. That is something that we just...
Yes, I just want to make it point that, but for the end-stage renal disease qualifications, you don't have to be 65 or older.
Right.
If you have end-stage renal disease,
Yes.
period.
Right.
Yes,
Regardless.
and so that's why, again, we go back to, well, why did we pass this Affordable Care Act law, right? It was to include in legislation and in the language of our laws, basic minimum things, right, that our health insurance companies and our states must abide by because we have chronic diseases, we have, right? And these were people that even in the end stages of some of these diseases were being cut off, tapped out. So, but again, similar to Medicare, and then there's something that I don't know how many of you guys have heard, the donut hole for Medicare holders. Does anybody know what the donut hole is? Am I at the right slide? Yes, you have a question.
Yeah, before this one. Those people have to pay for Medicare? It depends on how much they earn.
Okay, so that's the donut hole, and that's where I'm going to get to,
Oh,
and I'm
okay.
gonna. That's what I was asking. So Medicare under the ACA, so you get more preventive services for less, not for free, right? For less, you can save money on brand name drugs. There are certain diseases that there are no generic medications for. It just, and so it helps with that. The donut hole, and that's where I think you're going, will supposedly, again, language, right? The intent is that the ACA will help close the donut hole by 2020. So, when you're on Medicare, so you work your whole life, you pay, they take Social Security tax, they take stuff off, so then you're eligible to receive Medicare, right, at 65. Medicare can supplement. Medicare does not cover all your medical expenses, just like none of the other plans do, right? So let me see. So at 65, I'm married to a school teacher with a pension. I've been on his health insurance because it's better than mine. I work in nonprofit usually, I'd be buying one of those packages too through my nonprofit. At 65, I can apply for Medicare. You get your Medicare card. There are things that Medicare will cover, but if you're also eligible for Medicaid, and so you end up with a Medicaid and a Medicare card, some folks, right? And so there are things that Medicaid should cover first, and then whatever's left, Medicare will kick in, and sometimes vice versa. Prescription primarily, what it does is that it covers prescriptions for 65 and older, but then ultimately, because as I've said and I'll continue to say, none of these plans cover everything at 100% for everybody. So what happens is that you will find seniors who buy a supplemental plan, and that's Medicare A, B, C, and then C really doesn't exist, but then there's D, and this whole other realm that I'd be more than happy then to bring my colleague who's the expert in that end, do that for us at another point in time. So yeah, this is whole, right, A, B, C, D, right? And so what it is that there's some of our Medicare holders have what's called a spend down. And so in periods during their the year, they have to out of pocket contribute to this amount of money that they must spend down first, or pay into to spend down first, before their Medicare then picks up again. So there's like a lapse in the year for some seniors, and that's what's referred to the donut hole. And supposedly, and we're hoping that by 2020 that goes away, and that these seniors aren't taxed or don't have the burden of somewhere smack in the middle of a year in their Medicare, that then out of pocket, and those, it varies person per person by income and circumstance. It could be $3,000, it could be $4,000, and this is out of pocket for a senior, okay? And that Medicare coverage is protected. My whole adult life, as long as I've learned what Medicaid and Medicare is, and Social Security, for some of us that are not so much millennials, right, but maybe Generation Xers, right? Oh my God, Social Security is going to go away. By the time I retire, there won't be any Social Security. I won't get any Medicare. I spent my whole working life paying into that. ACA legislation, the law aims at least protecting Medicare coverage. Okay? Another dense slide, and we're gonna, right? So this is a dialogue. I'm doing a lot of talking, but we'll keep asking questions. So, health insurance, our marketplace in Connecticut, and the application process for this, right? So yes, the 2015 enrollment period for individual health and dental insurance is closed. You cannot apply unless, and I'll get to the unless, but the next enrollment period begins in 2016 for coverage. Okay? So from November 1st, 2015 through January 31st, 2016, you can submit. The other thing that was different from ACA enrollment in the first year and in the second year, in the first year of launching this, we had 6 months to work with people, to get the word out, to get people signed up, right? Second year, we got 3 months. It will be another 3 months. So if you look at the time frame, there's only 3 months every year to switch your plan, to pick a different plan because if your first plan didn't work, or to sign up if you're still uninsured. It's not a long time. And and this is it, right? Non-negotiable. Those are the dates, right? Enrollment in Medicaid Husky in any of our states' health insurance, children's health insurance program, that happens year round. So if you know a family, if there's a family member that qualifies for this, they can go and they can apply at any point during the year. Specifically, remember that huge number I shared about how many uninsured children we have? Specifically for children. Now there's a new member in your family who needs to become insured, right? Adoption, similar to childbirth. So now there's a new family member, right? A spouse, a member of your household who's insured has passed away. Marriage, because now there's a union and so now there's more family members, right? The loss of current health coverage. So you may be working and you may be insured and you've never had to participate in the exchange because your employer gives you health insurance, but check this out, your employer just closed up shop and now you're unemployed and you can't afford COBRA. Does everybody know what COBRA is? Right, that's what you pay out of pocket to keep the insurance that your employer was covering you. So if you've lost employment and you've lost your health coverage, that is a qualifying event, right? So you can still go into an Access Health Connecticut office, call, go on and apply, right? Loss or reduction in, I just said that, the employer insurance contribution. So maybe your employer was covering you at 100% and you didn't have any out-of-pocket expenses, right? And you still have health insurance, but now you have this amount of money that now falls on you. You can, dibble and dabble in the supermarket. Like I said, I called the ACA, I called the Connecticut Health Exchange a supermarket, state representative friend, and I know when we go to the supermarket, we clip coupons, we do our work, we want to make sure what's on sale, we want to go there educated so that we don't spend more than what we have to, right? So, employer insurance contributions, if you've become new legal Connecticut or U.S. Resident or obtain U.S. lawful presence, that does not mean that DACA, and everybody knows what I mean by DACA, Deferred Action for Early Childhood Arrivals, or that individuals who are undocumented in our state are able to, even if they wanted to buy it at 2 times the cost, buy health insurance in our exchange, okay? But we have legal permanent residents that become citizens all the time. We have people who didn't have legal permanent residency that were here on a visa and now become legal permanent residents and get green cards. And they are eligible to participate in the exchange and become insured. The group that's still not included in the legislation are undocumented individuals, okay? And if any of these life qualifying events speak to you or someone you know, call Access Health CT. You don't have to wait till the next enrollment period, okay? Fines and penalties, right? So, last year, does anybody remember during the first enrollment cycle what the insurance penalty, what the penalty was for not enrolling if you were eligible to participate in the exchange was? It was an individual fee of $96,000, and the response from the community was, that's not so bad, right? I can come up with $96,000. I'm going to talk to you about what that's going to look like every year after that, right? After 2014. So if you do not have qualifying health coverage and you do not apply for and receive an exemption, there are exemptions. There are religious groups that, due to their beliefs and our Constitution, respects and protects, our religious views. There are certain groups that there are certain things around health and health insurance, and so that's an exemption. You gotta prove that, right? You gotta document that you belong to, X, Y, and Z group. If you don't qualify to receive an exemption, you will have to pay 1/12 of the yearly fine for each month that you don't have coverage. And this is again where we need to be a savvy and educated consumer, right? And we need to take our little pencils and a pen and paper. What does that mean out of your annual income every month just because you didn't sign up, right? In 2014, what that translated to was 1% of your yearly household modified adjusted gross income, the MAGI. Okay? Dope? Real good. Right? So basically, that's where the $95 came from. This year, that $95 for an individual turned into $325. For 2016, $695 in a penalty. And FYI, that penalty will be taken out of your IRS tax return when you go file taxes, because some of our forms through the IRS are being modified, if not already done so, because we're in tax season, where there is a question that's going to ask you, and you're going to have to prove that either your employer provides health insurance and you're covered, or that you've done so through the Affordable Care Act. If not, you will be fined. And if you're a family, then it's not just the adult person times how many adults plus for each child that's uninsured in your house that you're going to have to pay fines for. Okay? And those are also non-negotiable. Yeah. But I'm happy to say that in Connecticut, our Lieutenant Governor just this past week announced there will be a special enrollment period between April 1st and April 30th, which is not too far away, after you pay your 2014 fine, and you attest to the fact that you first became aware or understood the implications of the shared responsibility payment after the end of February 15th, possibly through an affidavit or something, some form that the IRS will put out, and so once you pay your fine, when you file your taxes, then and you attest to this, then between April 1st and April 30th, you have one more opportunity, if you're still uninsured, to access the exchange and buy coverage, right? And with that said, so what do we do now between now and then? You get prepared. You get all of your filing information, all of your, citizenship, residency, documentation, your federal income tax deductions, everything you need to document that you're eligible, if possible, for a subsidy to help you with the cost of the premium, and then learn about the different packages and which make sense to you, and become an educated consumer when buying your health insurance. Okay? These are some of the documents you need. Your social security number. So I don't forget. So you know how I shared, if you're undocumented, you're not allowed to participate in the exchange? If you know someone like that, then don't let them get duped when they file their taxes with their TIN. They're also exempt from a fine. So if you can't participate or buy health insurance, then you can't pay a fine for not having it. So, and there's a lot of confusion in community. So I wanted to throw that out there. So anybody that you know that may fit that bill, that fine does not apply to them, and they should know that. But any policy numbers for current health insurance plans that you may have, that you want to change, that you want to convert, that you want to, right? And then if you receive health insurance through your employer has something, or should have something that's called an employer coverage tool. For every job-based plan that you or someone in your household is eligible for. It's very similar, like when you start your job, they give you the books here's the insurance we have. The book is like 100 pages, pick a doctor, right? So there is an employer coverage tool that's supposed to help you do this, just like you're navigating the 4 different insurance plans that I shared with you in the exchange. to also be able to make educated health decisions and financial decisions for your family, even when it's through your employer, okay? And where in Bridgeport can you get some help? So if you think you qualify and you think you want to seize that opportunity, April 1st through April 30th, right? Because it goes like this, right? In Bridgeport, it's the Action for Bridgeport Community Development, 1070 Park Avenue, the Bridgeport Child Advocacy Coalition, Mount Airy Development Corporation, as well as you can access accesshealthct.com. And there's a whole other list of their specific in-person assisters and sites. Stay tuned at this website because the details for that special enrollment period will start rolling out. They just made the announcement last week. And then those details will start hitting the Access Health CT website. Thank you.